record. Hi, and welcome to Heart Health with Michelle. Today I have Dr. Julia Kogan with me, and she is a stress and sleep expert. I'm going to have her introduce herself in a second. I'm just really excited to talk about this really, really important topic for cardiovascular health that sometimes is underlooked or sometimes we don't even really know it's there. So before we dive in, I'd love for Dr. Kogan to introduce herself and tell us a little bit more about you.
Yes, and thank you so much for having me. I am a health psychologist by trade with a background in neuropsychology as well. So I work with people to identify additional factors outside of their medical condition that might be impacting their health or worsening medical conditions. So that might be their stress levels, their sleep, other kind of lifestyle behaviors, maybe kind of anxious thinking, things along that line. It's been really interesting for me to work on both sides of the health psychology, which is trying to catch people earlier in the disease process, and then in the neuropsychology, where we're often evaluating people who have already had a lot of cognitive difficulties or changes because of often untreated medical conditions, sometimes poorly managed stress, sleep issues. This is I think a really important topic, and a lot of people wonder about it. And often we don't know that stress can have so many physical impacts on our lives.
Yeah, I love that. I think it's so important. And when we say you want to reduce your stress for cardiovascular disease, we have to look at it in the sense of you can't live a life that's stress-free. There's going to be stressful moments, right? And when we have those stressful moments and our stress levels are high chronically, that's when we start leading to a weakened immune system, to cardiovascular disease, to extra pressure on the heart. But if we can, manage it and identify it and be able to work with it appropriately, we can help to reduce our risk of cardiovascular disease and all of those complications. So one of the things that I really think is so important for our audience to realize is, how do you know your stress? I work with a lot of individuals who work long hours, who are at the top or, in the top category of their company. And oftentimes they're like, yeah, I work all the time, but I love my job and I'm not stressed. And there's some underlying stress habits that I can definitely pick up upon that they don't even realize they're stressed. So I'd love for you to kind of go in a little bit of, how does someone even realize they might be stressed in that moment?
Mm-hmm. Yeah, I think that's a really great question. I work with, I would say kind of a similar population. And oftentimes when people are being referred to me, it's not because they're saying like, I'm so stressed. Sometimes that is the case, but oftentimes it's for other things that we don't always realize are related to stress. So definitely some physical signs, I would say, are often what bring people into primary care or to other settings. But I think it's important to remember that stress is a very physiological response that actually causes physical changes in the body. So when our stress response gets activated, our heart rate goes up, our blood pressure goes up, we experience muscle tension. People may be familiar with the fight or flight response. Basically is to protect us from danger. So in a moment of true danger, we can either stay and fight whatever the threat is, or we can try to run away as fast as possible. And in order for that to happen, the body responds very quickly. So that's why we'll experience things like muscle tension. Our breathing will start to change. It'll become more rapid, shallow, come from our chest rather than kind of breathing more deeply. When this is happening, unfortunately, digestion is paused because in a moment of true danger, you don't need to be digesting. And same thing with our immune system. Those are not the most relevant things in a moment of true danger. So our digestion will pause, immune system functioning will not be as active in that moment. So as you were saying earlier, if we have a stressful thing that happens, this response gets activated, and then we feel better, that's pretty typical and normal. But what happens for a lot of people is this response is constantly getting activated, and they're not necessarily knowing that it's due to stress or other kinds of factors. And so they're chronically experiencing these issues. So a lot of people suffering from unexplained digestive issues, for example, that can be a really good time to ask yourself, is my stress being managed? Getting sick a lot without necessarily an explanation for it, that can be a reason as well. Constant headaches, other kinds of strange physical issues that maybe there's not a medical explanation for, or there is a medical explanation for, but the treatment you're doing is not seeming to resolve it. So a perfect example I can give you is I see a lot of people with high blood pressure. They're taking their medication, they're following dietary recommendations, they're exercising, they're doing all the things that we, ideally would like them to do, but stress is really high, they're easily irritable, probably because stress is high. Maybe they're quick to anger. All of these things are going to still increase your blood pressure, even if you're doing everything from a medical perspective and really being proactive there. So I would say these physical symptoms are a really good clue to check in with yourself. Is maybe my stress more activated than I may think? So you can love your job, and that's wonderful. And I'm glad to hear that, a lot of people you work with do. But at the same time, you can still be experiencing this kind of overactivation of your stress response, causing a lot of those physical issues.
Oh, completely. Yeah. And I think that's very well said. I also think that many times people look at medical conditions in silos, but so do they look when you're looking at the whole approach to healthy, optimal cardiovascular health, right? When we look and people are saying, oh, wow, I exercise so much. So isn't that going to protect my heart? But when we look at the whole picture, if you're really good at exercise, really optimal in nutrition, really optimal, I mean, sleep and stress are so correlated. So usually if stress is high, sleep isn't going to be very high, isn't going to be good quality, because high stress levels decrease melatonin production. And then we have that issue there. But if you only look at one category of, oh, these are great and these aren't, we really want to slowly, depending on where you are in your journey, to really assess all categories. I think you really nailed it, and that nailed the explanation. And I love how you really dived into that. I think it's also important to kind of look at the long-term health effects of this increased heart rate and increased, if you're in this heightened state for a prolonged period of time, think about it. Your arteries are going to be constricted. And if your arteries are constantly constricted, you're putting silent damage on your heart muscle, which can cause an enlargement, which can cause heart failure, which can really impact it. And also from a perspective of cardiovascular health, you can have a lot of plaque in your arteries, but you might not have a heart attack until you have a really stressful event, and that triggers inflammation in the arteries, which then ruptures or creates the plaque to become unstable and cause a blood clot. So many things, and we undermine the importance of dealing with stress. But I think we say, stress management, how do we address it? So, okay, we know it might be there, or even if we don't realize it's there, we still know we need to have some management tools in our toolbox. Let's talk a little bit of how do we address stress management? Because for every person, it's going to look a little bit different.
Mm-hmm. Yeah, I think that's a great question. Definitely very individual. Although I would say, I personally like to work with people kind of in three parts. I have named this my master stress method. But I think that there's not just one thing, like you said. So people will exercise, which is awesome. Keep doing that. They'll be eating well. These things individually are really wonderful. The more things we can combine, though, for kind of like a whole health approach, the better just our physical and emotional health. But the first really important part, and this goes along with what I was mentioning about those physical symptoms, is often stress is going to be activating the nervous system quite a bit. And so in order to calm the nervous system, we need to be doing a variety of different exercises. And this actually these exercises are not going to only help with stress, but they help with sleep. They can help with chronic pain management. They can help with different medical conditions like hypertension. So calming the nervous system is going to be one very important aspect of it. The other part is we really need to kind of master the stress mind. I like to refer to it as anytime that nervous system is getting activated, our thinking starts to change. So our thinking becomes less focused. We have less effective problem solving and decision making abilities. We're just a lot foggier in general. And then also when we're stressed, we tend to kind of think in very negative ways about ourselves, our abilities, our ability to manage, and that further increases stress and can even cause sleep issues as well. So getting a handle on any negative impacts of stress on our just general thinking abilities, as well as directly targeting some of those unhelpful thoughts that are actually causing our nervous system to be even more activated. That's really important as well. And then the third piece, as we're putting this all together, is going to be kind of the low stress lifestyle factors. So these are some of the things we may have briefly mentioned already, but how are we physically moving our body, which is going to be so important? What are the foods that we're eating to support health, energy, to prevent or manage any medical conditions? Our sleep. So sleep, especially with my busy, ambitious professionals, tends to be the first thing that is kind of put to the wayside. But I always encourage people to remember that, you're doing yourself a huge disservice by skimping on sleep. Yes, maybe you have a few more hours to do whatever it is that you're doing, but skipping on sleep, you're more cortisol, the stress hormones being released. So your nervous system now is going to probably be more activated. You're going to have less energy, attention, and focus. So you're doing things, but you're not really doing them with your highest level of cognitive ability. So you're kind of spending more time doing things where you could maybe have that time for something else. And then that increase in cortisol can actually also make it harder to sleep later, which is also going to, weaken our immune system and can also be a risk for cardiovascular issues as well. So we really want to address all three of those in kind of a comprehensive way to be physically healthy, emotionally healthy, but also manage stress on a regular basis.
I love it. I think it's also important because all of those things really look at all aspects of optimal health, right? If you're stressed, it's going to impact sleep. If you're stressed, it's going to impact your food choices. It's going to impact your ability to lose the abdominal weight that's the most dangerous for cardiovascular disease. It's all connected. And when you are stressed, it does impact sleep because cortisol blocks melatonin production. And we know from many studies that if you don't get optimal sleep quality and quantity, it increases your risk for a heart attack by 20 to 35%. So we know the importance of it. It's just prioritizing and realizing that these are things that we can't skimp out on. We need to set boundaries in whatever, job or responsibilities we have to nourish our own bodies, to optimize stress, to optimize sleep, to ensure we're looking at and physical movement in all these categories, because if you're not healthy, if you're not optimizing them, it's going to catch up to you and lead to a complication. And so that's super, super important to assess, right? I also think it's important if you're taking a lot of melatonin or you're having sleepless nights, that could also be a sign of many things, from sleep apnea to other issues with caffeine consumption. But stress might be one of the reasons why you're not getting adequate sleep. And so we need to get back down to that core of assessing it. And I think we live in also a culture where we don't like to talk about our stress or our emotions or our feelings in public just because it's not very much discussed. And we need to acknowledge if we need to seek a therapist or to seek additional support, that's really important to do so in order to protect your health and in order for you to reduce that stress in a productive way.
Yeah, absolutely. And I like to encourage people to think about, do you want to be the most productive, energetic, confident version of yourself? And I think most people, including probably me and you, will answer yes. So if that is really what you want, then getting to the root of managing the stress and all those factors that I mentioned related to that, that is ultimately going to really help you to accomplish your goals, prevent or manage any kind of medical conditions, and really reduce especially your risk of cardiovascular events and risk factors as well.
I love that. I think it's also important to note a lot of times when people say, you should do stress management, the first thing that someone says is do breathing exercises, do yoga. And someone might say, you know what, that doesn't resonate with me. I can't get into that space. And I like to say, create your own meditation and breathing, seek additional support if if you have struggles with those things, because we want to make sure we're not just brushing it off, because it can do silent damage like many things in cardiovascular health. And so we need to be proactive and really be truthful and honest and transparent with ourselves and making sure that we are addressing the super important category.
Yeah, absolutely. And, I think what you just said is important. Is a lot of the people that I work with, they have tried yoga or they have tried, this or that. And I think that just goes back to, what we talked about earlier is, I wish there was just one thing, and not that we have to overwhelm ourselves with, working on a million things at once, but, managing stress, getting good sleep, functioning at your optimal productivity and cognitive ability. It really is a mixture of various things. So when we can kind of put these puzzle pieces together in a way that makes sense for you, ultimately that's when you're going to be the most successful. So if, for people who are watching this, if you felt discouraged because maybe you've tried certain things, it might just be that maybe there are some tweaks or things that might need to just be put together a little bit differently for you, in addition to some of the things that you have tried already.
I love it. I love it. So if you can give kind of a action point or a takeaway from our session today, in our conversation, what would you tell our followers?
oh, there's so many things. I'm gonna have to just choose just one. I mean, I'm gonna go with 1.5 if that's okay.
Yeah, please.
The first thing I would say is, just based on some of the things that we talked about, just really just kind of doing an inventory with yourself. Are you having these physical issues that maybe are not explained very well? Are you suffering from poor attention, productivity, procrastination, avoidance, even if you love your job? Are there other certain kinds of behaviors that may actually be related to stress or poor sleep, for example? So just kind of checking in with yourself. If you're thinking that those things might apply to you, then kind of the more take home message I would say is that stress, anxiety, I would say is probably one of the more treatable things, which is the good news. So I do want to encourage anyone, if you are struggling with stress, anxiety, and how it's impacting you in your life, it is very, very treatable, and there are a lot of things that can be done. It's just really kind of finding that combination that works for you. So depending on where you're at, some coaching might be a good fit for you. If it's more of a kind of a moderate to severe anxiety, then therapy might be a better fit for you. But there's definitely a lot of options to be able to kind of step into your most optimal self, which is the good news.
I love it. I love it. Thank you so much for joining me on this podcast. This is Dr. Julia Kogan, and you can follow her on Instagram and also visit her website. Thank you so much for being here.
Yes, thank you for having me.